Well, new this morning, Golisano Children's Hospital says more kids in our community are struggling with their mental health because of this pandemic.
It means more kids going into the ER because they attempted suicide, and many are placed under a Baker Act. They're committed for psychiatric hospitalization.
So our Jessica Alpern is live at the hospital now, where mental health advocates are working to help those young people. Jessica, what can you tell us about this situation?
Well, Lisa, they say that right now more than 46,000 children in our community are in need of mental health care. And listen to this. They say there has been a 66% increase in the amount of pediatric emergency room patients being placed under Baker Act. But one of the biggest problems is that our community continues to experience a shortage of providers to get those children the mental health support they need. According to the VP and medical director of behavioral health at Lee Health, Southwest Florida was already experiencing a behavioral health epidemic before COVID, which has only worsened things.
We had sort of the trifecta of difficulties. We had very serious behavioral health crisis in Southwest Florida before COVID. COVID came, and with all the social isolation and a variety of other stressors, made all of those symptoms worse. And then we've also had ladled on top of that an unprecedented amount of social unrest that has increased the level of what I think about as ambient anxiety and stress in the culture. So all of those have coalesced to produce, I think, the most serious mental health crisis in my career, and I'm 63.
One of the reasons he feels that way has to do with this. Every 30 hours, we lose a child in our country to suicide. But when it comes to access to care and early intervention, our state has a problem. Florida has less than 50% of the providers and double the preventable inpatient days compared to top performing states in our country. The state is ranked 36 for per capita spending for pediatric mental health services. It's why experts say we're seeing an increase in bullying, school violence, drug use, and self-harm. And when it comes to COVID, we've only just started to experience its impacts.
We're going to be in the traumatic phase of the COVID epidemic on the behavioral health side for years. It's just the way trauma works.
So when it comes to addressing this growing problem in our community, there are three critical areas. Now, I'm going to be going through these throughout the newscast, but one of them is improving access to care. This is important because right now, kids in our community who need mental health support are dealing with an up to 8-week wait list for that help. Another area we'll talk about is community engagement. It's why Kids Minds Matter is working to unmask the crisis facing our youth through an upcoming event. So I'm going to introduce you to a local student who is fighting her own ongoing battle with mental health, how she's now working to reduce stigma and create awareness for issues like this, coming up in our next half hour. Reporting live from Golisano Children's Hospital, Jessica Alpern, Fox 4.